Welcome to Module 6 of Torts. Should be able to talk a little bit about malpractice, insurance, tort reform, and things like that. Implied consent, you might want to talk about that. Might want to have it explained. Go ahead and ask questions as you come to them. Use course messaging. There is no live classroom quiz for Module 6. The insurance overview, think about the definition of insurance. What is the definition of insurance? What is it there for? It's two things. One of them is to compensate the person who is who's actually both injured in some way, either physically injured or injured in terms of property loss, called first-party insurance. The person buys the insurance and that person is injured or has property loss. And then the other insurance is to compensate and assist somebody, I'll put it in practical terms, somebody who is sued for someone else's losses. So that's called third-party insurance because it's not directly benefiting the person injured. It ultimately perhaps will if it's justified, but it is to benefit somebody who did not buy the insurance who has been injured. So third-party coverage, first-party coverage, and of course, many times in one policy, such as an automobile policy, it includes both, first and third. One of the extra torts we didn't talk about so far is placing the plaintiff in a false light before the public. It's easy to do now. You can juxtapose pictures. A person could face Photoshop and make it look like somebody was at a place doing something terrible when they weren't there. So false light would be kind of easy in today's world, but it's also easier to sue. And then, of course, there are other miscellaneous torts. Malpractice is failure to exercise due care, but in a specialized way. Failure to exercise due care in a person's profession or vocation in a way that causes injury. And of course, do you have the same problems as with other torts in terms of having elements that have to be proven? Yes. Look in the text, look in the lesson notes, and it will explain. Professional negligence, of course, roughly the same as malpractice from my view. Tort reform, look at the pros and the cons. Remember that a lot of these items are pretty easy to see and comprehend if you just take a look at the lesson content. So tort reform and, of course, these items. I would definitely look at these items here with insurance. This is a nice one-sentence definition of implied consent, for instance. Implied consent is where the person consents to something by their actions. When you get a driver's license, you consent to a chemical test of your breath, blood, or urine to determine if the person has alcohol or drugs in their system. And of course, you might say, oh, that's incomplete. It's to make it short, they've done that. But of course, a person theoretically could have a driver's license and then never use it, never drive on the public roads. Well, yeah, theoretically true, I suppose, but most people the overwhelming majority of people will also drive on the public roadway. So if you're being a strict legal analyst, you might say, well, that's an incomplete statement. But in terms of just a teaching item to learn, this is a big help. Get it down to one sentence. And then, of course, for your notes, you might want to say, and using the public roadways, of course, which is common sense. Tort reform, pros and cons, these are good. And it's boiled down. And, of course, more elaborate in the text, more explained. Same thing with insurance and other items, explained more thoroughly. But this gives you a nice overview. What is full compensation? At one point, should somebody injured become a multimillionaire beyond, let's say, medical bills? Good question. Quality of life is sort of in the eye of the beholder, the eye of the jury, you might say, or of the insurance company that's willing to settle. Take a look at those items. Bad faith is something that has become more popular lately, that people are more willing to sue insurance companies for bad faith, for not being reasonable in how they pay out. Discussion. Talk about what Paula might do to set a cap on the amount of damages, positives and negatives, and some other actions Paula can take. The quiz is 30 true and false questions, damages, medical records, and Module 6 lessons. Insurance and tort reform is a lot of it, of course. So pay a lot of attention to insurance and tort reform. And that's all I'm going to highlight right now, since I don't see people coming with questions. I guess I can pause and see if there's any in the messages. I'm not really seeing any questions, but I will specific questions. But I did add 2 extra drops for the Module 5 written assignment because some folks were having a problem with the technology of dropping. They for some reason did it as 2 documents. So if you didn't drop it, I'll try again. But in my classes, if you take a class from me, it is acceptable to do it as 1 document. It's certainly acceptable to do 2 attachments for 1 drop. Call support if you run into more technology questions. Which is always in your course, 866-693-2211. I think I will pause and maybe wait around and see if anybody comes in.